He became aware of the fact that he had failed to pull up his pants. He was sitting next to her with his pants and boxers down around his ankles, a puffy diaper showing under his shirt tail. But this didn't seem like the right time to remedy that. It would have to wait. At the same time, it made their conversation a little awkward, since it seemed to make her the adult. It was hard to plead for his dignity when he was happy sitting in just a diaper. Well, she said, knitting her brow, apparently deciding how to address his question. That is a good question. I wasn't going to bring up the topic with you so soon, but since you've asked, we should discuss it. She scooted a little away on the table and then turned to face him, best she could. The first time, yesterday, it was just habit. As you know, I have 2 little boys, both of whom are still in diapers. The older one is just getting interested in the potty. I change them the same way I change you, of course, and cleaning their bottoms is just a part of that. An important part of that, wouldn't you agree? Nobody likes a dirty bottom, she said, as if it was a religious tenet of some common faith they shared. So yesterday, I just did to you what I usually do for them, just to make sure their bottoms are clean. I always wipe them, then check the wipe to see if it is clean. You know, to see if they need more attention down there. You can imagine my surprise yesterday, when I checked the wipe after cleaning your bottom, the wipe came away a little dirty. Apparently you don't wipe enough after you poop. He sat, shocked, and didn't know how to respond. I didn't want to hurt your feelings, because I imagine it's something most people would be sensitive about, so I wasn't going to bring it up. But, you asked. Julie was watching his face, monitoring his reaction. It's not that big a deal to me, you understand. I've generally noticed that male patients, tend not to pay as much attention to wiping, so I wasn't surprised. But you're welcome to work on that a little bit if you want. She hopped up. If you look clean for a few days in a row, maybe I'll just do spot checks, she said, smiling, trying unsuccessfully to meet his eyes, which were firmly staring at the floor. I'm sure you want to be clean, and I want that, too. I'll quit poking your bottom once you show me you can clean yourself up to my standards. Deal? His cheeks burned, unable to believe they were talking about this most basic of bathroom habits. His stunned silence was interrupted by her hand on his chin, lifting his face until he couldn't help but look in her eyes. He expected them to be critical, disgusted, accusatory. But they weren't. Julie's eyes were warm and happy. Now that he was looking into them, he couldn't remember what she had asked. Deal, she said again, amused at his distraction. Yes, he said automatically, unsure at first what he had just agreed to. But she seemed to want him to agree. His answer appeared to make her happy, so that was good. That's my good boy, she said, releasing his chin and his gaze, and looking down at him. He was still sitting in his diaper with his pants around his ankles. Now you'd better get your pants pulled up so I can open the door. We'll have a patient waiting, I expect. He hadn't realized he was still half undressed. He jumped off the exam table and pulled up his pants, hurriedly trying to zip and buckle himself. She smiled fondly at his hurried efforts, then disappeared to start the afternoon. He didn't really have time to ponder her comments, as they were a little behind due to his question. By 2:30, however, he really needed to pee, and found a full teddy bear cup at his workstation in between patients. He wet himself nearly without thinking as he downed the cup under her approving eyes. When she turned away immediately to busy herself with a different task, he understood that it wasn't time to be changed yet. But he worked quickly, and was rewarded with Julie waiting outside a patient room 30 minutes later. She gave him a follow-me look he had learned to recognize, and obediently did so. The familiar, pants down, hop up, led to a quick dry diaper, and he was able to finish the afternoon quickly.